Hello everyone, welcome to our webinar. We are glad that you have joined us. So today we are going to talk about the channels which appear to be the most engaging in HCPs communications.
Let me introduce myself. My name is Vada Komarenko and I'm Digital Excellence Manager at Viseven. And today with me is Alexandra Klimchuk, Digital Excellence Lead. Now, let's wait a couple of minutes for all registrants to join us. In the meantime, we want to remind you that this is a live streaming and you are welcome to ask questions. Just type them in the chat window and we will answer them in the end of the session. Also, this webinar will be recorded and might be sharing your request. Okay, let's start. To begin with, we'd like to show you an image which you probably have already seen before.
So, have you ever been wondering how much face-to-face time does a pharma representative actually have with HCPs once they come in for a call? As data says, it's only a few minutes, as little as 2-3 minutes in most cases.
And that's natural, because with more patients to see every day and more paperwork to do, HCPs just don't have time for pharma sales representatives. So when it comes to sales rep communication, it means that approaching a physician directly is no longer the preferred option. And according to SAT survey, nowadays 68% of doctors prefer online modes of communication because they are more convenient, faster to get response, and easier to touch with.
However, digital marketing methods can amplify the success of pharma sales reps and help them provide additional materials that HCPs will appreciate. So it's crucial to not only reach out to your audience on a regular basis, but understand what methods of communications are preferred by HCPs.
Now, let's take a look at some of the key insights from the Healthcare Professional Communication Report for the year of 2018. According to this report, 87% see a lot of benefits in digital devices. Moreover, 50% responded that optimizing of mobile devices is crucial. Since half of the responders said that they primarily read their email from their smartphone, and 33% choose tablet or laptop as the main device for checking their inbox. 79% of respondents use materials given by the life sciences companies. 73% of responders preferred emails for industry news, product updates, and information about research and educational opportunities, beating out options like in-person visits from representative, direct mailing, or exhibits at professional conferences. 57% of healthcare providers see value in social media and plan to use this channel in the future. And 46% of the physicians are using medical journal websites. So digital is a new frontier for physicians, and it's the best place for pharma sales reps to meet them. And of course, it's important to connect with the right channels.
Also, it was mentioning that one of the most common complaints from physicians is that sales reps deliver not relevant data or with very little personalization. As a result, most rep visits seems repetitive and don't keep physician needs in mind. So it's necessary to personalize the approach to every physician and present data carefully and meaningfully.
Getting the right tools in place is essential to personalize medicine. And as we can see from this slide, sub-survey respondents said that such technologies as big data capture and storage, predictive analytics, collaboration, as well as decision support tools are necessary to personalize medicine.
So, the most effective way of ensuring your sales communication with physicians is by offering physicians exactly what they need. Ask physicians about their preferred channel of communication, whether it's email, face-to-face visit, remote call, e-detailing, or whatever. Each physician will have their own vision of how they like information delivered to them. So, let's have a look at some figures.
On this slide, you can see our monthly benchmarks of products and services provided by Viseven company as per our clients' requests. As you can see, each month we create more than 950 new detail aids from idea to realization, more than 520 localization to multiple languages, about 1,200 updates and adaptations, 870 email templates, and more than 360 landing pages. So these figures show that what's popular with our clients nowadays.
Furthermore, based on our 10-year wide experience of content development in the global pharmaceutical market, we can surely say that the top quality customer experience is ensured thanks to multi-channel mix. Enable all of them: emails, face-to-face and remote communication, social media, portable devices, apps, websites and landing pages, virtual meetings and conferences.
Multi-channel approach provides maximum engagement. Moreover, if you approach HCPs with the content which is connected across all the channels, you will get maximum recognition despite the engagement. So, our advice is to connect your content across all the channels.
Here at Viseven, we are experts in creating pharma multi-channel content on the regular basis. We are dealing with creation of e-detailing content. These are interactive HTML5 format presentations with the help of which you can engage with your HCPs audience and collect the KPIs from each face-to-face or remote visit. Also, we are creating email templates, either web-triggered or broadcast. Then goes remote detailing. We have a special platform with the help of which doctor can be reached remotely at any comfortable time. The data from the call can be stored to your CRM for the analysis. As the best features of this platform that you can allow control to the doctor during the call. Doctor in his side can play with all interactivity and all his answers will be collected. Also, we have projects on virtual and augmented reality. We have an experience in creating 3D medical videos for various purposes. We are experts in creating various mobile apps, either for doctors or patients, depending on the need of our clients. And two more services are landing pages and surveys. We must admit that it becomes possible to manage all the amount of digital content for different channels via a single platform across teams and regions, and this platform is eWizard.
eWizard platform is our unique solution, which enables to create and manage, update and localize key messages in a fast and cost-effective way across any channel, be it an email, an e-detailing, or a whole website. So eWizard is the main solution for content production, driven by cost-effectiveness, modular approach for efficient content reuse, covering multiple channels and aligned with the main digital content production principles in pharma. The key capability of eWizard is modular content framework, which enables to create, update, and reuse cross-channel modules. eWizard multi-channel content builder, localizer, and converter. It makes it easier to assemble channel-specific content, email, e-detailing, or website within global templates, update and localize them effortlessly in a cost-effective manner, and also integration with corporate ecosystems. This integration helps to publish modules for approval and distribute final content to selected channels and system automatically into Viva, Viva Vault, Salesforce Marketing Cloud, Adobe Experience Manager, and others.
Actually, eWizard provides the whole cycle for marketing across channels, starting with eWizard Global Store, easy conversion to CLM, interactive localization, transparent management and collaboration, and ending with smart KPI monitoring, smooth approval processes, publish automation, and analytics.
Thanks to the flexibility of Viseven eWizard platform, your HCPs are able to effectively respond to their patient needs by choosing what is best for them in terms of product info, clinical data, as well as the patient awareness and support. Furthermore, with eWizard platform, you can reuse the materials you already have in stock. This sustainable approach allows companies to save budget, reduce the rounds of MLR review, and build a better engagement models with both HCPs and patients.
Natalia Andrichuk, CEO of the Viseven company, believes that the unique digital solutions from Viseven empower pharma representatives to deliver personalized content to the audiences, and by acting smartly across the whole spectrum of channels, it is possible to turn the brand into a memorable and vivid story, ensuring high level of audience engagement.
Also, recently we at Viseven introduced a brand new approach to content creation, connected content. It means that creating it once, approving it, you can use it everywhere, from e-detailing to the website. It is possible due to the smart modular approach. We split content into the flexible independent fragments. This enables to reuse, repurpose, and republish content easily, without extra efforts, costs, and resources. Now content creation becomes fast and easy. To meet your requirements either with the agency or as do-it-yourself approach. As you can see on this slide, one and the same module is inserted into a different channels template. This is true, create once, publish everywhere approach in action, and we call it COPE. This gives the option to save time and budget on development while keeping the high content quality. With the COPE approach, there is no unnecessary redundant development. You can just reuse and localize the approved modules across the channels.
And how we do it? Due to cross-channel connected modules. Core message with media or graphs and references that are approved to be used together and can be reused within or across channels. eWizard is a content management system that is integrated with Viva Vault for easy access and management of content, including modules. All modules are functioning within connected content framework and are updated automatically in all the channels. For content distribution, eWizard is integrated with Adobe Experience Manager, Viva Vault Promomats, and IQVIA. We have proven experience in decoupling content from channels and transforming messages and related media assets and references into modules.
This is the high-level scheme of the content creation process. Starting with the content design and how we create cross-channel modules based on the communication strategy, global wireframes that are available, managing the general functionality and modules positioning. There are global master templates where modules are inserted and the final content assembled with a channel-specific template using cross-channel reusable modules.
The module is not developed with a specific channel in mind. It is channelless and is created just once and then published to different channels. Sales channels like CRM or CLM, approved email, remote detailing with integration to Viva Suite and IQVIA OCE, as well as to external digital channels like web with integration to Adobe Experience Manager, newsletter with integration to Salesforce Marketing Cloud, and social.
So the workflow is pretty clear and transparent. We create flexible cross-channel modules, and it's easy and fast to update them by reusing approved assets from Viva Vault or any other DMA system. You build content inside of the channel template just by mixing and matching modules, and then publish your ready email, e-detail, or a website to required channels just with a one click. This gives the unique opportunity to cut the manual work for updating content in each channel. With the eWizard, it goes automatically.
So, in other words, create once and publish everywhere.
So, summing up it all, we are sure that a strategic combination of different channels in communication with doctors can lead to the great benefits. That's why the best option ensuring high level of engagement in communication with HCPs is using the multi-channel approach. And our own eWizard platform is your indispensable helper in executing your multi-channel strategy. Adopters of the eWizard platform are appreciating this solution for more efficient budget allocations, quicker time to market, and top quality customer experience.
So this is all for this webinar. We want to thank you for your attention. Hope the information highlighted during this webinar was interesting and useful. In case you have some questions or comments, please simply send us a message via email and we will be happy to contact you back. Thanks again for joining us and have a good day.